Stress. Definition of stress. In medical or biological context, stress is defined as physical, mental, or emotional factor that causes bodily or mental tension. Not only stress causes mental tension, it also causes bodily tensions. That is nothing but it causes some physiological changes in the body. As a result of it, person feel tensed. That is mental tension. Types of stressors. There are mainly two types of stressors. One is external and another one is internal. External stressors are further divided into five types: physical, social, organizational, daily hustles, major life events. What is physical stressors? Any changes in the climate is called as physical stressor. Social stressors, changes in the society, is nothing but sociological stressors. The way how we live is one of the example for this social stressor. Organizational stressor. When you're working, you got lots of assignments or lots of work from your boss and due date is very less. Then you'll feel stressed. That is organizational stresses. Mostly these organizational stressors are related to work environment. The next one is daily hazards. Changes in day-to-day life activities, such as daily activities what you do. For example, if you're a student, you have to go to college, you have to catch the bus. If you miss the bus, you'll feel stressed. So daily hazards that you face day to day in your life, that creates stress. Major life events, for example, death of a close person, is a external stressor, comes under major life event. Then the next one is internal stressors. Again, under this, three types of internal stressors are there. One is lifestyle choice, second thing is negative self talk, and third one is personality traits. Lifestyle choice, the way how we choose to live sometimes create stress to us. That is lifestyle choice stressor. The next one is negative self talk. Talking about ourselves in a negative way. For example, giving a statements like I'm useless, I'm hopeless, I don't know how to do any kind of thing, I'm very bad at doing that. Those are all negative self talks. And the last one is personality traits. There are some personalities, usually they are very negative, or else they are very particular, they are very perfectionist. Those people faces the stress. Let me give you an example. Pessimistic people, they will always see everything from negative side, so that creates stress to them. Perfectionist, they always want everything to be in a perfect way. That is their personality type. Due to that, they face stress. If anything is going wrong, they face stress. So this is personality traits are nothing but characteristics. Next one is types of stress. There are mainly two types of stress: eustress, distress. Remember, whenever you make a side heading of these types of stress, don't start as positive or eustress. Instead, start as eustress and distress. Why do we call it as eustress? Eustress is good stress, positive stress. Why is it positive? Let me give you an example. You have an assignment submission tomorrow in your college, but you just remember before you are going to bed. How do you feel? Usually we feel stressed. But some of the people, they sit and they do the assignment and then they go and sleep. So the result of that stress is positive. You finished your exam and you are ready to submit whenever your teacher asks. So the result of stress is positive. That is why we call eustress is a positive stress. The second one is distress, is a negative stress. Most of the time, whenever people experience stress, the result is going to be negative if they don't know how to cope with it. The next thing in the stress is stress response. How do people react to stress? This is called as general adaptation syndrome. In medical terminology, it is called as general adaptation syndrome. What is general adaptation syndrome? It is nothing but the physiological changes that takes place in body of the people who faces the stress. And this has three stages. First one is alarm stage, second one is adaptation stage, and third one is exhaustion stage. In this alarm stage, there is a response called as flight or fight, either escape from the situation or fight against the situation. That is flight or fight response. So, let's see the first stage, that is alarm reaction stage. In this stage, people will experience initial symptoms of stress, initial symptoms of changes in the body. And in this itself, when they experience those initial symptoms, either they will try to escape from the stress or they will try to fight against the stress. That is fight or flight response. In this, our body will prepare us either to escape or to fight against. Now let's get into the details of this flight or fight response. The main organ of our body that responds to the stress initially is hypothalamus. In this picture, you can have a look of hypothalamus and also just look at pituitary gland so that you will understand the location of pituitary gland and hypothalamus, and it will help you to remember the topic well. Now let's get into the process. How these bodily changes will take place. What all changes takes place in the body? Mainly, there are two types of responses from the hypothalamus. One response is through the sympathetic nervous system, and another response is by secreting the hormones called as CRF, corticotrophin hormone. Let's first have a look towards sympathetic nervous system. So what happens whenever hypothalamus recognizes that the person is having stress? Immediately, hypothalamus will give signals to the sympathetic nervous system, and those signals will go to the adrenal gland and soothe muscles through the nervous pathways. The signals from the sympathetic nervous system will transfer to the adrenal glands and smooth muscles through nervous pathways. And in adrenal gland, the impulses will go to adrenal medulla. In the picture, you can have a look the location of adrenal gland and the location of adrenal medulla. Adrenal medulla is a layer, innermost layer of the adrenal gland. And this adrenal medulla will release two types of main stress hormones. They are epinephrine or adrenaline, norepinephrine or noradrenaline. Both epinephrine, adrenaline are same, norepinephrine, noradrenaline are same. The next thing is hypothalamus. I also told you that hypothalamus will also release a hormone called as CRF, corticotrophin releasing hormone. This hormone will take the signals to the pituitary gland, and pituitary gland will release a hormone called as ACTH, adrenocorticotrophin hormone. This ACTH hormone further influence adrenal cortex. So this is the adrenal cortex, outer layer of the adrenaline gland. This adrenal cortex further will release 30 different hormones. The hormones that are released from adrenal medulla, they are epinephrine, adrenaline, norepinephrine and noradrenaline. And the hormones that are released from adrenal cortex, they are 30 different hormones will cause initial symptoms of stress. I hope this is clear for you. In fight or flight response, hypothalamus will react in two different ways, through sympathetic nervous system and by releasing hormone CRF. Further, this hormone will affect on pituitary gland, thereon on the adrenal cortex. Whereas the impulses that is being transferred through the sympathetic nervous system through nervous pathways into the adrenal medulla will release two types of stress hormones. They are epinephrine and norepinephrine. And these are all the main hormones that are responsible for initial symptoms of stress. Now let's see what are the initial symptoms of stress. Increased heart rate, increased blood pressure, pupil dilatation, veins that are transferred through or from the skin get contracted, blood glucose level increases, smooth muscle relaxes, and it will allow the oxygen to transfer to the emergency functions, to the emergency organs such as brain and heart, and people will have trouble on focusing smaller tasks. So that is what about initial stage of stress response. And the second stage is resistance stage. I told you already, people either they will try to escape or they will try to fight. So during this process, they usually people end up in a resistant stage. In this stage, what happens is there will be lower amounts of cortisol, is nothing but stress hormone. Lower amount of cortisol, so that body will start repairing itself and the blood pressure, heart rate becomes normal. However, there is some amount of cortisol in the blood that makes the body to remain alert. You might get a doubt, why did I mention here blood? Cortisol in the blood. So the hormones, whatever being released from hypothalamus to the pituitary gland, from pituitary gland to the cortex, they travel from one area to another area through the blood. That is why I told you presence of cortisol in the blood. Now, if the people are out of stress, that is really good thing. The body get completely repaired and the person will acquire pre-stress state. If at all the person is not out of stress and if stress is still continuing, then he will remain highly alert and he will learn to live in that way. If you call some people, they always their response will be very quick. They are very highly alert people. You might feel sometimes why he's responding, why he's so very active, hyperactive, something like that. That is not really hyperactive. You can also notice some kind of tension on their faces. So those kind of people have adapted to live in that way and they are facing stress in their lives. So when this continues, the continuous secretion of stress hormone, that is cortisol, takes place in the body, and increasing BP, irritability, frustration, and poor concentration will be there for those people. If this is the scenario, and if this further continues, then they will end up in stage 3, that is exhaustion. So, what happened in the exhaustion stage? In exhaustion stage, people, as I told you already, they are in a continuous for a prolonged period of stress. That is why we can tell them as prolonged stress or chronic stress. So due to this chronic phase of stress, people physically, emotionally, mentally, they will become helpless. They will not have any strength to deal with the situation, as because they struggled for a longer periods with the stress. That is why they got exhausted and they reached to a point where they say that I can't fight anymore. And that is the situation where they end up in hopelessness. They feel they are hopeless, they feel they can't do it anymore. At that stage, you can see the symptoms, or the people who are in exhaustion stage will experience the following symptoms such as fatigue, burnout, depression, anxiety, decreased stress tolerance, and effects in the physical functioning of the body such as weakening of immune system and other stress related illnesses related to digestive system or any other stress related psychological disorders as well. Now, if you see any people that they are into depression or anxiety, they have faced a very good amount of stress. I should not say it as good amount, I can say it as longer periods of stress. That is why they ended up into a exhaustion stage. When they come into exhaustion stage, they can't fight with the stress anymore and they will end up into depression, anxiety, all these things. Okay, and not only that, people who are in exhaustion stage, they'll have very less immune system response. Their immune system is very weak. Why their immune system is very weak? Let me give you an explanation for this. In initial stage, when I explained signs and symptoms of initial stage, I have mentioned there is blood supply only to the emergency organs for emergency functions. Due to supply to the emergency organs such as brain and heart, the supply of blood is less to the immune system and to the digestive system. And if this continues for a longer period, it could be like for 6 months or more than that, the immune system will not receive any amount of oxygen or necessary nutrients. That makes the immune system become weaker, and automatically people are prone to get different types of infections. Hope you understand why people facing stress for a longer period will get physiological or physical disorders also, especially related to immunity. Yes. Now, stress management. For everything, there is management, even for stress. The very first thing that people have to look for is why are they stressful? What made them to feel stress? They have to find out reason that is making them to feel stress. Once if they find out the stress or stressor, either they have to try to avoid the stressors, or else, for example, one of your friend is causing stress to you. Avoid her, or else change your friend, go to other friend. Or else if you really like that friend so much, then try to accept her and adopt her negatives and try to live positively with her. Instead, if you keep on going, uh, if you're not adopting, if you're not accepting, but if you're staying with that same friend, then it is difficult for you. You will end up in a stress. And I told you already what happened when you are into the stress. And another thing is get moving. Start doing your other things. Just go out for shopping or some other things. And next one is connect to others. Mingle with others. Mingle with your friends, or mingle with your neighbors, or mingle with the children. Start playing with them. Playing with the children is really a very good stress relief. And then make fun and relaxation. Yoga and meditation are highly rated as relaxation techniques. Most of the people relaxed when they practice this yoga and meditation in their daily life. However, I suggest it is not must everybody can do that. Everybody will have their own choice of relaxation. If you are an artist, you'll feel relaxed when you do some drawing or painting. If you're a good chef or if you can cook very well, you will enjoy your cooking. That is a kind of relaxation. If you're a dancer, when you dance, you forget everything, isn't it? So go dance. That is your medium of relaxation. So, like this, find out your own fun, find for your own relaxation when you are not able to practice yoga or meditation. Okay, and then manage time better. Always in life, there is stress is not the prior thing. You no need to look into the stressors always. Just keep them aside. Instead, try to focus on very important things that has to be done first. The next thing is maintain balance with healthy lifestyle. That is, you have to maintain balance in healthy lifestyle like taking good amount of food, that is healthy diet, sound sleep, good exercises. All these also help you to get relief from the stress and learn to live in a moment. This living in a moment or relieving stress in a moment is really expert technique. I can share with you two techniques. One is counting from back, either from 20 to 1, or else taking deep breath exercises. These things will help you for sure before you go for interview or students when before you face your viva. These things will really help you. I hope you all, whoever listening to this or watching this video, understood the stress very well. I hope this will help you to present well in your examinations and see you with another topic. Thank you.